Welcome to the first Seriously a Dental podcast, sponsored by Primo Dental. Today we're going to be introducing Dr. Mullen. We're going to be introducing Dr. Corsa, who you may have seen on the internet before with regards to Primo Dental. We're going to be discussing our lab, we're going to be discussing our study club, and just having a bit of a chat in general. And hopefully you haven't already tuned out. Welcome to Seriously a Dental podcast. It's our first podcast that we've ever done. Been speaking about it for a number of years now.
Too long, yeah.
Far too long. And we thought we'd take the plunge and give it a go. So whether you find it interesting or not, let us know. But we'll thought we'd start off by introducing ourselves. So my name is Ian. I'm one of the owners of Primo Dental along with Graham.
Yeah, I'm Graham. I own Primo Dental. We also have a lab as well,
We
which
do?
a lot of people don't know about.
Yeah, Primo
Um,
Studio.
But I'm clinical director, so I just oversee all the general treatments that go on. And then, luckily for me, I get the chance to speak to people like Steve and bring him on board. Obviously, we're welcoming Steve to the team. In fact, you've started now, haven't you, just about?
Yeah, pretty much. First proper day tomorrow, I'd say. So yeah, my name's Stephen. I am an associate dentist, primarily focusing on cosmetic dentistry, align, bleach, bonds, porcelain. But yeah, composite veneers is my kind of bag, and yeah, I really get a good buzz out of it, and I'm really excited to be back in Liverpool after a couple of years away. I think I was here for 10 years, so the city pulled me back. I love it here, so buzzing to be back, buzzing to join the team.
Yeah, we've actually been trying to get you over here for a while, haven't we?
Wee bit here and there, a little bit of flirting going on over there, I see, via WhatsApp, etc. But no, it was always kind of in the back of my mind anyway. But as I say, I've, similar to you guys, just pulled the trigger, took a plunge, if you want to call it that, and yeah, I'm buzzing to be back. Really buzzing.
Well, obviously, we're happy to have you on board because obviously it's another level to what we were currently offering. You know, we do a lot of treatments that are like lab made veneers, 3D printed veneers, edge bonding and freehand veneers are always like one of those things that if people are good at it, they can really, take it far. And obviously you've been involved in like a lot of very high quality cases and also teaching on courses and, obviously the education side, which is obviously really why we're doing this, is trying to just open up our knowledge base, pretty much,
absolutely.
isn't it? We've got very different backgrounds. Obviously, Ian and myself on the business side, probably myself and you on the treatment side. And, we're one of those that we like sharing it, don't we?
We do. So do you want to go back to how we basically started the entire business?
Yeah. I'm happy to talk about that. Are you happy to talk about that?
I am.
Yeah. So actually me and Ian met because I interviewed him in dental school.
You did back in the day, and you still let me in.
I actually said yes.
You
Don't
did.
know why. But yeah, that was like a bit of a strange sort of meeting where I had maybe, was it 8 minutes on that station with it?
I think so, yeah. And just to give you a bit of information about the interview. So you apply and then you do this it's like a multiple mini interviews. You go around different stations, you get given a bit of a preamble of what you've got to speak to this person about. Could be an actor, could be a different scenario. And then it says you can't speak once you're done. So I sat there thinking, I've had 5 minutes, and I just started saying so how long you been on the course for? Didn't have any idea, and I was just trying to get some more information. And also, obviously, I quite like to have a bit of a chat, and Graham does too, but he was biting his lip most of the time, can't speak.
Strict instructions, you're not allowed to talk.
Yeah.
Don't talk, you're going to lose marks.
And then you go on to the next one, and the next one, and the next one, and stuff like that. So that's where we met, essentially, wasn't it?
Yeah, and then I think 6 months later, you popped up in a conversation with my sister. Turns out that she met this guy on a dating app. Who claimed to be on first year dentistry, and I was like, "There's no chance."
Yeah,
I don't know that guy's name.
No.
And then I ended up saying, "Didn't I? Well, name this person. Who do you know from there?" And you're like, "All right, I'll be honest, I'm on year zero, so I'm not quite in the dental school yet,
Yeah.
which is actually the same route that I went.
I think it was technically my first year of dentistry. That was the way to put it. But then if you say I'm on year zero, you're like, isn't everyone on year zero?
Yeah. It's so confusing.
It is. But yeah, that's where we met. And
So I called him a liar.
Yeah.
And then
Got
turned
off
out.
got off on the right foot then.
yeah.
But actually, I was the one who interviewed him once. I recognised him and hang on, I actually quite like that guy. We had a bit of a chat after the interview, didn't we?
We did.
And then for one reason or another, we go through the journey. I was obviously 6 years ahead of you. I decided to start my first practice quite quick. I've always been interested in the business side rather than just the clinical bit. And I saw an opportunity basically to get a practice going in North Wales. And thought Ian's background was perfect. Rather than actually being a dentist and having an opinion I have to listen to constantly.
Yeah.
He's got a different background.
Yeah.
So I have to listen to him on the finance side, whereas he has to listen to me on the clinical side. So it's a good mixture, I think, isn't it?
Yeah, it definitely is.
I think that's true too, because you can really focus on just the business side, and then you'd have a fair idea of the clinical side. But when it comes into making big decisions and big financial ones, you've got that sounding board that, as dentists, I think we sometimes get a bit ahead of ourselves, don't we? And we think, I want the newest, biggest, shiniest thing. But you'll come in with a sort of more of a rounded view going, is this going to benefit the patients? What's the ROI going to be? So you got that perfect mix. That's what I've always noticed about you guys, because one is kind of like me. I'm not going to say which one it is, but big ideas. And then the other guys kind of, no, let's just think about this in a bit more of a rounded approach.
I think we know who you're talking about.
Yeah, I think everybody knows who we're talking about.
How many ideas today?
Yeah, that's it.
Yeah.
No, it's so I think obviously we started the first practice and it went well from month one, didn't it?
It did. Month one, which was 2019. I'm not sure if anyone can remember what happened in 2019, but there's a pretty famous thing that happened near towards the end of 2019, which we thought it's never going to affect us whatsoever. So anyway, we shut early 2020, which then was actually happened to be a very, very good thing for us from a business point of view. It was a hard first year, because obviously learning the process, getting everything sorted, being on a shoestring budget, very, very shoestring budget. Think earning probably less than minimum wage, especially the amount of hours that we worked and travelled and stuff every day. But during that time, we came up with the idea that you've alluded to, which was Primo Studio.
Yeah. So Primo Studio is obviously the lab. Most dental practices, they'll send out the lab work to different labs around the area, usually take an old-fashioned impression and someone comes to pick it up, and then you've got to obviously have that communication with an external company, try and get them to understand what you want, and then ultimately pay them for the product, which sort of means that the price points are dictated to us rather than the other way around. So our idea, instead of making the most of the sun during the lockdown, like most other people, we set up the lab. And we done that from my shed in the back garden. And I think you were in the shed in your partner's back garden or something.
Yeah. Or there wasn't a shed, so we had to build a shed.
Yeah.
Which was our getting build materials back then, or built the decking anyway. And we could kind of travel to, because we were both based in Liverpool at the time. First practice was Prestatyn, which we'll get onto where the rest of them are in a mo. And we had to travel through to North Wales with the excuse that we are actually doing work there. So if the police stopped us, we had a business, we had a reason to stop there. We only got stopped once. I think that was our builder got stopped once and just said doing building work, and they were absolutely fine with it. Yeah, which was fine. But I heard stories of people who were sending suitcases through to their holiday homes and then just travelling like, no, we're not on holiday, we're just on a drive. And the stuff got delivered, so it wasn't quite as glamorous as that. And holidays in North Wales, it was literally ripping out old rooms and building bits and bobs out whilst everyone was enjoying the sunshine a lot of the time, wasn't it? And
it was a good opportunity, like you say. I think it came at the right time. We got off the roller coaster that was the first year, when most businesses technically find that year really hard. We've obviously used it as an opportunity to learn and put that into action, setting up the second company straight away, pretty much.
We did, which was an old surgery in our first practice in Prestatyn, which we quickly outgrew, just purely based on demand from our own staff.
Yeah.
So we then looked at extra locations.
Yeah. So we moved it to a new location, didn't we? Well, it was about 9 months after, was it?
Yeah.
We were there for like the last 5 years.
5 years, yeah.
And now we've recently relocated again.
We have.
And we're getting close to like outgrowing that space, believe it or not.
Yeah.
We only moved there in Jan.
Yeah.
But obviously it's very positive for us. Mainly to just see the fact we can bring more talent into the system. We've got obviously certain standards we like to keep, but bringing in new people with new ideas is always how you grow a business. You know, we don't know everything. I know I sometimes sound like I do, but chances are I probably don't. And so I bring other people in and obviously try and take their background into account when we're making these bigger decisions. Bringing in people like yourself is obviously, for me, is an achievement because, you know, a lot of people can come and go, but bringing on someone of your talent that we can then start offering a different level of service, but also bring you onto our courses. You know, we've recently set up a study club.
Yeah.
You're involved in that side, so we can obviously offer your experience and your skill set that, you know, I'll admit I'm more of an EMAX guy.
Yeah.
You're more of a composite guy.
Yeah, fair enough.
You know, that's definitely coming from a different background.
Yeah.
So, I mean, have you ever done anything like that before, course-wise, or?
Well, yeah. I think, well, funny enough, you mentioned study clubs. I think that's basically how we met each other. Maybe about 7 or 8 years ago now.
Yeah.
Maybe about 2018, sort of around the time you were starting to think about opening your own practice. I remember you telling me that at the time, and I was like, yeah, absolutely, go for it. But at that point, I was like, wow, I'm just like totally just getting my head around private dentistry and moving from NHS to private and doing all the courses under the sun, clinical ones, that is. So yeah, the study club we met on 2018. We've done a lot of lectures for local dentists, obviously, but it was also for the students in the dental house in Old Swan in Liverpool. So that's something that I'm always been interested in. I get a real buzz out of teaching, and you know, I love that collaborative kind of mindset as opposed to, you know, a lot of dentists would maybe kind of stay in their own lane, maybe not mix or interact with others. It's quite a lonely profession at the best of times. So having that kind of collaborative approach to our job is not only better for the people that are in the room, but also for us because it gives us a real sense of achievement, I think. And so that's something I've always been interested in. I've taught on other courses, injection mold composite courses. I've taught in London, I've taught in Stamford Bridge, I've taught in lots of different places around the UK and in Dublin as well, actually, back home. So, you know, I do enjoy that side of things. I'm really looking forward to, you know, moving forward with that now. In 2026 is it's a real kind of goal of mine to kind of get back into that and then the kind of mentorship and showing people how to do things to a high level.
Yeah.
That's kind of my next sort of fire that's in my belly and sort of marries up with what you guys have planned as well.
I think we're both at that stage now, aren't we, where we want to give something back, and it's not necessarily just about putting a course on, make a load of money. You know, it's not about that. It's about sharing the knowledge, getting the education level up there that, you know, especially new dentists recently qualified, you can see all of our work online. You think, how the hell am I going to do that? And actually, we can talk you through it step by step. You don't need to be spending 30 grand on a course.
We've done that.
So. You know, it's not cheap to be a good dentist ultimately, is it? So, you know, but giving them the stepping stones so you can just allow that progression.
I think between us all, actually, we've maybe not said this, we've all done NHS work between us and the other associates. And we've gone through that whole plethora of, so some of us have done specialist training, oral surgery, implants, EMAX, like you say, digital smile design, lab, business, scaling business, opening new sites, making mistakes maybe along the way, but learning from them. And certainly that's something that we can sort of expedite for a lot of new dentists that are coming into our profession and go, you know, I really want to get into this. How can I get into doing implants? How can I get into the digital side, the lab side? We've got all that experience that we maybe only just realized recently. We've done all these things, kind of learned it all ourselves, and as I say, learned the good things, the bad things, and made mistakes maybe a long way with small jobs here and there. But maybe this can get clipped. But the point I'm trying to make, I guess, is we've been there, and between us, we've got a couple of decades of experience and all those things. So it's that side of things too, about how we can teach our mentees or our colleagues how to communicate better and make better choices early in their career, so we can all have a good career because there's plenty of room for us all.
That's 100%. Like you say, there's always enough people to go around. There's always that dentist who's on the scene who wants to prove themselves, or the one who's claiming to be the best at the time, whatever it is. But I think everyone can benefit by sharing a bit of knowledge.
Yeah, absolutely.
We've set up the study clubs basically to offer 3 hours like worth of free training almost. So we're very lucky because we've just been told that Coles is going to sponsor our first evening, which is lovely. And we're going to be able to teach people how to do injection mold composite, which is it's quite a unique sort of skill set, and obviously allows the lab to be more involved in the design process. So it's something that the patient can see before they're actually coming to the point of actual treatment. You can try the teeth to make sure that they're happy with the shape. Talk about shades of teeth and things like that, and have a bit more communication about the case beforehand. And it actually allows therapists as well as dentists the chance to offer a high-end product. We want to offer that as free as possible. Yeah. So obviously getting these sponsors on board was actually a real coup for us, isn't it?
Yeah, it is. Yeah, big time. I think it's looking from kind of, obviously I am in dentistry, but looking from the outside as a non-clinician, I kind of pick up a lot of stuff as I'm going along, and I will always sound off people to say, like, so why would you do that? Why not do freehand as opposed to doing the doing a technique that would involve the lab a bit more? So what would you guys, what's the advantages of doing an injection mold compared to freehand and vice versa?
I'll jump in first because when you've got my skill set, having the lab design and manufacture something that makes it more efficient is very important. So my main thing is I don't want to spend 3 hours and end up with a product that doesn't look good. Whereas obviously from your point of view, I would feel much more confident as a patient seeing you, knowing that you actually have the skill set to do the work without the need for the lab involvement necessarily.
Well, there's kind of levels to it actually, to be honest. But what you say about this, having the 3D design made for you, or at least holding your hand through that, it means when you get to actually do the composite, you'll know how much. You don't have to think, I suppose, how thick it has to be. You know, the shape and the difficult canine teeth and things can be hard to do after a couple of hours. You know, we're human beings. Our eyes get fatigued, our back gets sore, absolutely, even with the best chairs and ergonomic chairs and loops and all these things. But if you're starting out, that is an amazing way to do it, because you just get used to handling the composite, and you'll get used to fixing little chips that might occur, like working out where stains happen. So it's kind of a really nice sort of jumping off board. But then you can take it to the next level, and you can still use your lab to do 3D designs. You can then start doing a bit of freehand work on top of the 3D designs. You can add texture, layers, different colors. So certainly it's not just let's do injection mold and that's how we do it. It's a great starting point if you're interested in cosmetic dentistry, because at the end of the day, that's how 3D Emacs is made. That's how you can get your head around Exocad, all these different softwares, and you build up a good rapport with your technician as well. So if you're able to do that from an early point to a good level with the aid of a lab, then it's an absolute no-brainer to start with that. Because it's as I say, it's a starting off point for many other cosmetic dentistry things.
Definitely agree with that. Obviously, that workflow is actually very adaptable, isn't it? Like you start your cases off with solid photos, good communication, understand where a patient wants to develop their smile.
Yeah.
And then actually that workflow can be adapted then. Do we want to do composite? Do we want to do Emacs? Is it an implant involved case? We're going to have to move teeth and put them in the right place to receive the veneers. So obviously bringing braces into the equation as well. So it's actually a very good way of, especially inexperienced clinicians, coming up with an overall plan. You can start collaborating more with other dentists.
A confidence will come in time. You know, there are dentists out there that have been certainly doing work after a 2-day course and then getting burned essentially. You know, patients' complaints. You know, we have to be so careful litigation wise, and our regulator is obviously very stringent. Let's just say to call it that without saying anything else than that. So I mean, that's a real good way of picking a simple case. You know, you've got a lab technician that's going to help you. You know, you've got me, you've got you on the other end of WhatsApp to say, look, is this going to be a good case or not? So like things like that is a real good way of developing your confidence, certainly. And as I say, it's a no-brainer to get started with composite in that style. Even just 4 teeth, you know, you don't have to do the 10 or the 20 teeth. You know, it's or even 2 teeth. You know, people start with that. So it's a no-brainer, like I keep saying.
Yeah, I think that's literally where we both started, isn't it?
Yeah,
You know,
pretty
literally
much.
with that
pretty
technique.
much it. Yeah.
I remember I stopped doing injection mold a while ago because one day I talk about it all the time. I think I've got PTSD.
We've all got that.
Yeah, I had
Post teeth stressed as well.
Yeah.
I ended up with one day where I had 4 patients booked in, all for top and bottom. So I was doing 80 veneers.
Big.
And by the end of the day, I couldn't see anything but white.
Yeah.
And they all wanted like the bright shade.
BL1.
Yeah.
Yeah.
Oh, it was a tough day, but obviously I talk about it now, and that was like 6 years ago.
Yeah.
So I was like, right, I need to move forward with this, make it more efficient again. And that's where I started looking into the EMAC side.
Yeah.
Which for me was more predictable in my hands. And that's where you develop your skill set, isn't it?
Yeah.
I've always got like more of an interest in the surgical bit, the implant side, restoring individual teeth and matching it into everything else.
Yeah.
Which, you know, if you've used the same workflow again and developed that skill set at the early stage, you can also adapt it to implants as well, which a lot of people don't do. Smart design with implant work. They have like an individual tooth, restore the individual tooth because the lab's just made a crown to fit it. Whereas actually, if you start that conversation early, learn that communication with the patient, a lot of the time they don't want just a 1-2 fix. It's going to be...
That's it, exactly.
Yeah.
It's super, like, as you build on that, it's super important to have that conversation from day one, because if you do say 2 implants on back teeth, missing 6s, missing 5s, and then they'll say, oh, well, what about this? What about these lower teeth that are crooked? What about this front tooth that's sticking out a bit? Oh, you need ortho for that. Oh, but we've just done implants. Oh, we can't really do, and it kind of just makes it a bit more of a clunky thing. And then the patient that loved you for the implants that you've just done, you're like, I can't actually treat you anymore.
Yeah.
So you're better getting your ducks in a row.
Yeah.
And that smile design thing, starting from the front, starting with the end in mind. What's the ideal smile for this patient? You know, you're not trying to sell it to them. You just say, look, Mrs. Jones, like, you've got these 2 teeth. Do they annoy you? Is there any problem with them? Or, oh yeah, that does actually annoy me. Well, can we do something with that as well? Opens up a whole can of like options, a whole world of options for the patient. So it helps you then again build on your clinical portfolio and your skill.
Well said.
I think coming from my world, obviously again listening in and speaking to different patients and stuff like that, a lot of people don't know what they're looking at. They obviously I won't go down the turkey teeth route, but they think a veneer is a crown, you know, stuff like that. So if they don't know the options, how can they almost like you'll almost like objection handling with yourself by not discussing it with the patient. Whereas people say, just come in for an implant, let's just do that, fine, I'll do an implant. As opposed to, where do we want to go? I want to have this, obviously everyone wants the perfect smile, everyone wants a Hollywood smile, whatever it is. But obviously whatever you guys can do as best for that patient, if they don't know where you could end up, well, you've done the patient a disservice from that point of view. So you've got to give them the options as far as I'm concerned. Yeah, they want an implant, great, but what about the rest of the stuff? And let's discuss it. And this might be a bit of a longer process. However, this is where we'll get to in the end. So it could be that you start with composites from that point of view. And then obviously if it's been designed or whatever, can you take that design and then make it into something more permanent, like a porcelain veneer?
Yeah.
Something like that.
Yeah, that's it. A lot of people do use that as a stepping stone as well. You know, you'll start with a composite freehand or injection mold case, and then it's almost like a trial for the next 5-7 years. And then at that point you say, right, I'm ready to commit to something more long lasting or less maintenance, whatever it's going to be. So yeah, it's definitely a stepping stone for that. And actually, if they're unsure, you're always best going for composite first, aren't you?
Yeah. Even just to take that back a step, what Ian just said on yourself, you know, when you're having those conversations with patients and you're trying to get into that world of doing more high end stuff, more technical work, 90% of the problem is actually getting to start off, getting the first few cases through. So I think that's definitely a dentist's flaw, I guess, because we're kind of conditioned from a young age in dental school to look after the health of the patient, and you almost feel guilty about saying to someone like, you can get this, is going to cost X amount of thousands. It's hard to just get over that first hurdle. I know that was certainly my case. So when you do have those conversations, it's easier to have it early in your career and just bite the bullet and just think, you know what, I'm actually not looking after the patient without offering these options out. Because if you think almost like you just want to get them in, do their fill-in, send them home, but if you don't have those conversations, are you actually looking after them properly? Are you actually letting them know, you know, this could actually improve your life, this is going to improve this tooth wear you've got, this is going to improve your periodontal disease. So the cosmetic dentistry and aesthetic dentistry is not just about making things look good.
Yeah.
Part of looking good is actually being healthy. You can't have one without the other. So it's almost like to go back, as I said at the beginning, getting good at communication and having those chats is going to be something that we'll probably talk about on the study clubs as well. So yeah, it's almost all encompassing from the beginning.
No, 100%.
Taking it back to the beginning.
Yeah.
Do you want to give us a bit more information about yourself, like where you're from, where you studied, got you into what you're over and stuff like that? Give us a bit more background on yourself.
So I am from a place called Derry, made famous by a certain TV show on Netflix about 4 schoolgirls, Derry girls, who I know one of them actually.
Yeah.
You put me on the spot now. Well, I'm not going to say I used to work in Liverpool, but you're going to have to clip this. What's her name?
Which character?
Curly haired Michelle.
Oh yeah. Oh god.
Jamie Lee.
Yeah.
So I've met her a few times over the years. She probably doesn't remember me, but she's the most people's most favorite character, to be honest. But
the mouthy one.
The mouthy one, yeah. So I'm not quite as mouthy, but maybe some people would say that. But I'm from there originally, and then I always wanted to be a dentist. To be honest, I was one of these kids that actually loved going to the dentist.
Yeah.
And kind of was good at the sciencey stuff, and I was interested in healthcare. So done dentistry at Queen's in Belfast, and then I was around the time credit crunch, a bit of a recession going on. There wasn't much jobs available. There wasn't many jobs available at home, but there was a careers fair in Belfast, and there was an opportunity to work in Liverpool or Manchester as like a locum dentist, traveling around what was then IDH, my dentist. They're my dentist now. And it was a salary job. I gave you an idea. It was a good idea for me because I wanted to move away and do something different. I had friends in Liverpool. So I'd done that for about a couple of years. So it was actually great. I'd worked in loads of different practices, seen what was good, what wasn't so good, the corporate world, principals that had sold out and told us what their practice was like before and after the buyout. So I got a real good sort of network in Liverpool, and I ended up loving it, so stayed. And then I ended up leaving there and getting a practice job, or a private practice job, should I say, up in Manchester, which I loved, and it kind of introduced me to composite. And my boss, Stuart Grundy, he's now retired. He was going to do a master's degree in King's, and he said, well, I'm going to do a master's in the minimally invasive dentistry. So I was like, okay, well, I'll do it too. Because I was at that age, I was like, you know what? I may as well. And I was working in the NHS for a few years at that time, and I was like, this is not for me. This is not what I envisaged at all for myself. So meeting him and getting into composite, and then the minimally invasive thing and the digital dentistry thing was all coming out at that time. So I guess I got lucky in a sense. I was in the right place at the right time. But when you put yourself out there, you kind of make your own luck as well, I guess. So I done the MJDF exam with him, done masters at King's College London, and then worked with him for a couple more years, doing a little bit more direct composite work. And then I started doing study clubs in the dental house in Liverpool. That's when I met yourself. And then, as you said, COVID hit, and I worked in a few other practices around Liverpool, teaching as well, and London. So yeah, that was my kind of story in 2 minutes. But along the way, I really developed a love and passion for like Invisalign, composite, as I've said many times already. Love doing direct composite, edge bonding, trying to do more natural kind of work.
Yeah.
So that's kind of my whole career to date. But yeah, I feel like I'm only getting started. I feel like I'm still learning all the time.
You're only 21, aren't you?
Yeah, yeah. Add a few more years on that. But yeah, that's kind of my background. And like I say, we've always had similar ideas. Anytime we ever meet up, we always bounce ideas off each other. Maybe
both like Guinness.
Both like Guinness. I know Ian will probably temper our worst impulses for dental ideas, big shiny new things, and pints probably as well.
How expensive is it?
How expensive? Yeah, do it. Hold back on that. But so yeah, that's
nothing's cheap in dentistry, is it?
Nah,
no, it definitely isn't.
You want to invest in that new thing? Well, you're gonna have to work very hard to get that next year. Never mind.
Yeah,
that's it.
Yeah.
Well, you invest. Well, think about how much it costs to qualify. It's a big investment in yourself.
Yeah.
So obviously everything else is an investment in what goes on around you at the same time.
Yeah.
Technology moving on. It's obviously moving on, isn't it? Obviously with internal scanners and CBCTs and stuff like that. But maybe there's a lot of still like older techniques still out there. So we've kind of pulled things around to like the technology side of things as much as we possibly can originally. So when you're coming across now, whereabout are you going to be working?
So it'll be primarily based in the Primo, the World Clinic, just over the water in Morton, through the tunnel. to begin 2 days a week while I finish off my clients in Belfast. That will be for the foreseeable. It's sort of open ended. When you do our kind of work, you can't just up sticks and leave.
Yeah.
Orthodontists that are maybe listening to this will testify to that. It's takes a bit of time, but certainly looking forward to it. As I said, I've done like a bit of a trial day. I've already done Nicola, the other dentist. I've done her composite veneers already for her a few months ago, so I've got a good taste for what it's like, and it's a real good, real good chilled atmosphere.
That's
also
that's a good thing. That, I mean, obviously, even another dentist, again, is highly skilled, as long in a career as Nick, who trusts you to do it. That's, I mean, I'd say that was a fantastic thing.
Yeah, she's the first one.
Yeah.
So but it was nice. Like, we were friends for many years, so it was a nice thing to do. Obviously, Nicola, she's like the principal kind of dentist in the World Clinic, so it was nice to go to her practice, sit in her room, and do it in her chair. And I was like, well, I was a bit nerve wracking at the beginning, but then once we got going, it was fine. Like I say, our practice itself's pretty zen. Everyone gets on really well, so it's a lovely atmosphere in there. Yeah.
I think that's one thing that we've always tried to do in all of the practices, to be fair, isn't it? Like, just try and keep the professional attitude, but also quite relaxed. You know, you don't want it to be white coat and stuffy. It needs to be relaxed atmosphere. Everyone feels comfortable being there.
Yeah.
Like, Nick actually done my teeth.
Oh, right.
I always do that. Like, you can get a good clip of me from every time I have an interaction with a patient.
Yeah.
And I only go, you can have these teeth.
Yeah, that's it. You're a walking advertisement, aren't you? Yeah.
So I had to get them done because she's done so many good cases, and I was like, do you know what? I need to have a piece of this.
True.
Yeah. But also, like, a backstory is that my wife, I'd only just started talking to her at the time.
Okay.
And she was like, Nicola's doing my veneers. So I was like, okay. I was a little bit annoyed that she was doing and not me, but that's fine. And then I was like, do you know what? I'm going to get mine done in a day. Just so that I get them quicker.
Yes, you had to get that.
I had to get them before.
You had to get the bragging rights.
Luckily, it went really, really well. All done in a day.
You left the house at 9 a.m. and came back with new teeth that night.
Literally,
she didn't know.
She didn't know.
Very good. See, that's the power of technology, isn't it? That's
power of owning the
power of owning your own lab.
Yeah, the lab. I had to say, look, pause that job for 1 minute. Just do these ones for.
Drop everything. My teeth are the most important.
Which actually then meant that we looked at that and went, well, why can't we offer that to patients as well?
Yeah,
you know. Turns out it actually takes us around about 5 hours, start to finish, to do the case. As long as we organise it right, we can actually do preparation appointments in the morning, go and have your lunch, look after yourself for a bit, come back in the afternoon, up to 20 units done in a day.
Veneers in the day,
yeah.
It's amazing.
Which was obviously an accident, really.
It was, yeah. Just, by accident, not design, I think.
Yeah.
Obviously...
My impulsive decision.
Yeah, but you look back at it and it makes complete sense. Why can't we do it? And it was always, I suppose, it might be a bit of a cliche that I own it, so I want it. It's like, no, we can figure this out, so it's going to be benefit the patient. And then obviously, ultimately, then we can offer like quicker turnaround times because we've developed this process. We've really honed it. We've got a great supply network, fantastic, like Emacs work. We use Ivoclar, which is like the best in the industry from that point of view. And everything we've got with the machines, obviously using Roland to do our machines. We've got Paris, who's got how many years worth of work and using those machines?
Yeah, 15, 20 years doing digital 3D printing and stuff like that.
You guys alluded to the experience between you two. I think in the lab, there's probably closer to 200, if not further years worth of experience. Like our porcelain guys, it's probably 100 years between them two. So there's
to be honest, most of that's Colin.
But they're absolutely fantastic.
Cut that bit out.
Elder states.
Don't cut it out. Keep it in. But I think that's the point. And the point of it is, we tested it on ourselves because Graham did my teeth.
Yeah,
so
right.
Graham just needs to do your teeth. Or I'll do yours.
No, I wouldn't recommend that.
It's
all right.
Let's see.
Give
it a few months. Give it a few months yet.
You won't get any more.
Give it a few months. We'll see how we go.
But I think that the point of it all is we've tested these things out, and because at the beginning we were so like honed in what we were doing, we could figure out like the shortcuts to make it better for the patients, better for us, more cost effective for us, while still giving the best treatment options available. So we're not scrimping on different equipment, not scrimping on anything, making sure the patients were happy with it, which has been going now since 2019. So we're getting should we say, long in the tooth.
Yeah.
Yeah, that's the name of the next podcast.
It's definitely pun intended.
Yeah.
I think, yeah.
I think the issue for us was always like trying to keep up with the development of the equipment, and the actual consumables have gone up by about 4 times the cost since we started.
Mm-hmm.
COVID was
like-
a massive one for them.
Yeah.
Yeah, so like, but we haven't actually had to increase our cost to the patient by the same amount because we've managed to keep the workflow right.
In-house.
Yeah.
Yeah.
Yeah, and we haven't put our Demplan fee up for 5 years.
Yeah.
Because we want people to just be members of the practice and keep coming back to us.
Yeah.
So as long as you're coming back every 6 months, we know we can keep on top of things.
Yeah.
Especially, it's so important with things like veneers, any sort of composite bonding that you've had done, ortho.
Yeah.
Yeah,
is the
any
most important
maintenance.
part. Yeah.
And that just helps you to keep on top of it. But also, if we see something minor
Mm-hmm.
at a 6-month checkup,
Yep.
it's such a simple thing to fix,
Yeah.
and we can give you the best advice. If we don't see you for a couple of years,
Yeah.
you're normally starting again, aren't you?
That's it. I see that a lot.
Yeah.
I see that a lot. And a lot of patients, when they come and see me, certainly they'll get their treatment, and it'll be like a long appointment, and I'll kind of make them almost sign in blood that they have to come back in 2 to 4 weeks so I can check everything. And I'd say about 80% of the people do, and most of the time they're happy. But there's 20% of the people that cancel the appointment, say, look, I'm happy, I'm not coming back.
Yeah.
And then they disappear. And most of them, they never see them again, which is probably a good thing, because if it was a problem, they would come back to me. I always make sure it's pretty open about that. Any issues, come back, give them a guarantee, etc. But if they don't come back and then 2 or 3 years later something happens, it's usually not just one thing, it's like a cascade of things, and then they're paying again. All that money and all that time and effort. It's so important just to even have that 6-month membership. Come back, get a checkup, get it clean. You know it's going to be fine. You know that we're going to fix it for you if there's a problem. So that's like super important. I tell them that's the most important bit of the treatment. I stress it so much at the end.
Yeah.
You know what I mean? To come, make sure you come back even in a year. If you can't come back in 6, come back in 12. So that's the most important part of my job, I always say. The last bit.
We're still dentists at the end of the day as well.
Yeah.
We want to make sure that you're healthy.
Yeah, exactly.
Yeah. We've done all this work for you, but ultimately, let's keep things healthy and keep everything functional.
Yeah.
Well, things change, don't they? And obviously, it's not just about, oh, I need the fill, and it could be something else that's happened. Obviously, you guys will have seen it all. It could be something that's changed. It could be smokers. It could be different medication, which dries bits and bobs out. So people need to come in and see.
100%, yeah. And obviously, we do some higher end treatment, let's call it. We're doing like full arch implant work, same day. These are things we developed from the Emacs workflow.
Yeah.
We're now able to adapt that to all on 4, all on 6 sort of implant workflow. A lot of places don't do smile design for that. So it's treated almost like a denture that they then fix in the mouth with implants. Whereas we're trying to do it the opposite way, make it more aesthetic. Most implant guys are a little bit long in the tooth, and they're a little bit old-fashioned with that, and they think, well, if you're more worried about aesthetics rather than function, I don't want to treat you.
Yeah, it's obviously a red flag, but the reality is they both go hand in hand.
Of course they do, yeah. And giving someone really nice smile will make them more confident, and you can eat a steak.
Yeah, well, that's
bonus.
That's a big bonus at the end.
Yeah, we know how important steak is.
Yeah,
you'd only realise what you've. Hang on, you'll miss what I've gone off.
You don't know what you got till it's gone. Is that what you're trying to say?
That's a very good way of putting it.
Yeah,
I made a mistake.
Yeah. You're just under pressure with
That's why we brought you for the quick puns.
Awful.
This big light's putting under pressure.
It's warm, to be fair. So what we're talking about here, so with regards to the lab, obviously we've alluded to it. It's moved recently. So what does that change for stuff like you just said there, for like a turnaround time? If somebody wants to come in and see us, give us some ideas.
Well, we do a lot of travelling patients. So what we want to do is try and eliminate the number of times they have to actually attend for the finished product. We normally try and see people at least once before, because we want to make sure they're healthy. Obviously, if there's any general work to do, having the lab on site means then we can book in the treatment day or next day, so that it means we're getting it done within a 24-hour turnaround a lot of the time. Having that on site means we've got ceramists, we've got the designers, everyone on site to actually come and meet the patients as well. It's great having good dentists who can communicate, but it's even better if they can see it themselves. So we have that option now in Chester because we've got the lab on site.
Yeah.
our standard turnaround from the lab is actually twice as fast as the average in the industry.
So what would that be?
So normally it's 10 working days for the average lab. We try and aim for 5 days for most products.
Yeah.
Implants a little bit different because, you know, certain products take a bit longer to manufacture. But yeah, we try and aim to turn around everything in a working week when possible.
What about if somebody maybe doesn't want to use the lab to manufacture stuff, but they want to use the designer? How long would that usually take?
Same or next day.
Okay.
Yeah.
Fantastic.
Depends if you catch guys on a good day or not.
Yeah, well, we've got guys on it.
Yeah.
Yeah.
So we've got 2 designers, and they both got really like good experience in the design side of things. Gaz in particular has got more of a interest in the implant side, whereas Anna's more ceramics and veneers.
Yeah.
Which means you've got a good balance of both experience. We can do some same day sort of designs to help with same day workflows outside of the industry, our brand as well. And next day for things like if people want to do chairside milling or printing, we can obviously offer that service very quickly.
Fantastic. Yeah, that's great. So, moving on, with regards to, obviously you guys have got a lot of experience. I'm going to guess that throughout your time, whether it was in dental school or whatever it might have been, that you may have had some weird interaction with could be a patient, could be a colleague, could be walking into dental school. You never know. There was a lot
weird interaction every time I see you.
Well, it definitely is. It's mainly around coffee, I think, most of the time, isn't it? Just to keep us going. But I think I can remember one for myself, if you want me to allude to it a little bit. This was around about, it was COVID time, and I was shielding a little bit because I've got asthma, so I kind of had to shield a bit. We've got cameras in the practice. And
right. I think I know where this is going.
Might have had a phone call off one of the nurses at the time to say, can you look at the cameras and go back? Because Graham's just got stuck in his tunic, which was just a grey tunic, which I'm guessing by that point you hadn't worn for probably 3 months' time.
Yeah, it was only 3 months, to be fair. There's no give in these scrub tops.
There was not in those ones, though. They were shockingly bad.
No.
But there's definitely, we will dig it out at some point, a picture, a minimum of a picture of you stuck in your tunic, which I think you may have had to get cut out, like someone who's had like a road tackle accident or a bike or something like that by one of the nurses.
Yeah, basically I put the tunic on. It went over my head okay, so that hadn't grown.
Sure.
And then I started pulling it down over my shoulders and was like, I've definitely shrunk this, but it's a bit snug. And then it sort of went bump and like almost like locked on.
Yeah.
And then it turned out I couldn't put my arms down. So I was like walking around like this. I'll make sure we've got at least a picture of that because I look hilarious.
Yeah.
And I'm sort of panicking now because I'm like, what do I do?
Yeah.
I can't actually get the thing off.
Yeah.
And also I can't walk around looking like an absolute fool.
Yeah.
And I had a patient in like 5 minutes as well.
Yeah.
Luckily for me, one of the old nurses turned up and she was like, once she stopped laughing, actually helped me get out of the tunic, which is not a euphemism, by the way. She literally helped me get out of the tunic. And I was stood there like propped up against something while she's pulling on the back end of this tunic. And it was probably the last time I wore a tunic until very recently.
And now you wear the slightly nicer ones that are a bit more forgiving.
Yeah.
With a bit of elastic.
You've got stretch in them though.
Yeah. Bit more
I was known as the guy who turns up in his gym gear for quite a long time.
Yeah.
I was just in the practice, generally bobbing round. And then if I'm needed for an opinion, I'll pop in. I'm normally either be in the gym or I'm on my way.
Yeah.
So I was always equipped, but for the gym, not for work.
Yeah. Probably more comfortable wearing gym wear anyway instead of a tunic because 5 sizes too small. I think my funniest one is actually on the very first day of me being a dentist. So this is like day one, VT year. Anybody who done their VT year or DF1 year as it's called now, you start in August, start of August, middle of August, obviously summertime, boiling hot day. So the last patient on my very first day was coming in, and he was a bit of a fan favorite with the nurses, let's just say. They were like, you're going to love this guy. You're going to love this guy. And they was like, who is he? And he's like, oh, he's a Polish guy. He's really big. He's like 6'5". And they all just fancied him basically. But he was a real gentle giant, really nice guy, really funny, really welcoming. Give me a big handshake. Welcome to the practice. I've been coming here years. And bearing in mind it was August, so it was like a really hot day, but he was wearing this like really big duffel coat, like a real big heavy coat. And I was like, what is he? Why is he wearing that? Because I was sweating in the surgery.
Yeah.
And then we got check up, whatever it was, and I was like, oh, this is great, great first day. Nothing weird's happened at all. Got through it, and then the corner of his like duffel coat pocket was like shuffling around, and I was like, is that a phone? Is that maybe his mobile's ringing or something? I didn't really pay any attention. And then at the end, he got up and said, nice to meet you again, Stephen. Nice to meet you. And he goes, oh, sorry about that. And he just went into his pocket with this massive hand and just pulled out a chihuahua. His dog, he took his dog for a walk. That's why he had his coat on, because he was going taking his dog for a walk. The dog was in his pocket, like
Just
a little.
put it in
He
his
just said,
pocket.
oh, this is such and such. This is whatever her name was. He just handed me his dog. So I was just like, this is my first day of dentist. So like, obviously I'm thinking, is this what my life's going to be like every day, dealing with crazy people? But that was the funniest story I think that's ever happened. And that was in the very first day of being a dentist. So it's all downhill from there.
I'd imagine that's not happened again.
Nah, it's not happened again. I've had plenty of funny interactions with patients, but that's the one that sticks out the most.
I can imagine, to be fair. Yeah.
No, fair. Yeah, I mean, I've got loads of interesting stories, I suppose, but one of the big ones for me was I had a chat once with a specialist in the area called Ian Dunn. You probably
Yes.
know him. Lovely guy, and the best bit of advice that he gave me: never treat your friends and family, because 9 times out of 10, that's the one that's going to go
Yeah,
wrong. Almost
I agree.
certainly.
Completely agree with that.
So I thought, I'll see what my mum's doing. She needed a bit of work doing. She needed upper implants and some other little bits on the lower. And I was like, looking at her filling at one of her back teeth on the lower. And I was like, I could definitely do a better job than that. Now, I didn't think about what Ian Dunn had said at the time.
You're setting yourself for a fall here.
Setting myself up big time. So while I was in there taking the old filling out that apparently wasn't good enough, I thought, oh, the one behind it looks like it needs replacing as well while I'm here. Take the metal filling out and put a white one in. Then I realised why she had the filling that she had, because she had the worst tongue ever.
Yeah.
Wanted to investigate everything I was doing.
Yeah.
Obviously, for putting a white filling in as well, you need everything to be really dry.
Yeah.
And it didn't matter what I'd done, everything
Yeah.
got wet every 2 seconds. I'm trying to basically fill a hole that I've created now.
Yeah. Yeah.
And
You're
really,
a
I
hole in
didn't,
your soul as well at this point.
it still lives with me now. I wake
Yeah.
up with sweats. And I'm a big one for like advocating lab-made restoration. So I was thinking, I'll get a scan of this.
Yeah.
I'll make it nice and dry, put an onlay on, which is like a bit like a crown, but it's not quite as big.
Yeah.
It gives us good properties for the restoration. And it didn't matter what I'd done, I could never get the bleeding thing to fit. And I ordered it 3 times, and I went through the design 3 times, but it was because it was my mum. It's never happened before, and
Yeah,
it
it's
hasn't
only-
happened again.
Yeah, it's only because it's your mum.
Just for my mum, and I just couldn't get it to work. And in the end, I just had this flashback then of Ian Dunn saying to me, like, told you so.
Yeah.
Don't comment on that other guy's work.
Yeah.
You know, and that's actually,
So true.
it's so true. Like, you don't know what's happened on the run-up or what the patient's like to treat. You might be absolutely fine. You've got a big wide opening for access, and then all of a sudden, anaesthetic goes in.
It's true.
They don't open the mouth,
Yeah,
or,
that's a
you
really-
know, there's
really good
something.
advice.
Yeah.
Really good
So yeah, definitely don't do that again.
Yeah.
Like, I've got one of our associates, Uday, to do
Yeah.
her implants now, so I'm not going anywhere near her. And I think that's very good advice going forward.
Yeah, that's good. To be honest, I'm disgusted about that. 'Cause you said don't treat your friends and family. You've done my veneers.
Yeah, you're
Oh,
not.
yeah.
Yeah, you're my business partner, not friend.
Yeah.
That's fine.
You've been promoted from friend.
I know the PIN numbers.
yeah, you know all of the passwords
I do,
to everything.
I
Yeah.
do, yeah.
I actually don't.
Yeah,
I haven't got a clue.
Yeah.
Yeah, I'm the day to day.
Yeah.
Use the password one.
Yeah.
I am. Yeah, something like that. It's usually thumb. So that's fine.
Yeah.
You can get in even if I'm asleep.
Yeah, we do need to think about that in your will, just in
Yes.
case.
Yeah.
Yeah.
There's we'll push that down a lot. Something like that.
Yeah.
Make sure you stay relevant.
Yeah.
yeah, basically, yeah. I just need to retire sooner. That's
I
all
know.
that's
Yeah,
it.
God. I've been semi-retired like 3 times now.
Yeah, I think so. Yeah.
I need to semi-retire again.
Yeah, just work on the weekends instead.
No.
Late nights and weekends.
Yeah, no one wants to work a weekend. Not in
Nobody
our
wants-
industry.
Nobody wants
Nah.
to work. It's 4-day weeks, isn't it, usually?
Yeah, if you're lucky.
Yeah. Saturdays for going to physio. getting your back sorted.
I thought you were going to say
Going
go
to
to,
some-
going to footy. Then.
Well, go to football after that. Yeah,
Well,
we could do that
that's
after.
why he had his tunic on so tight. It was like a
Yeah.
corset, basically.
Yeah, it was really, really,
So I
really,
couldn't
really.
get the gym. I was too busy in work.
You sure it wasn't like a 1980s Everton top you wore when you were like 5 years old?
Yeah, well,
Yeah, super stretch blues top.
remember those? What was it, the 1-to-1?
Yeah. Big, massive, baggy one.
Yeah,
big,
that's
Heather
right.
Campbell
That's
ones,
right.
yeah.
99 ones.
yeah.
Yeah.
Or Bakayoko, back of the Echo. Whoever it was, yeah. Thanks for making it this far on our first podcast. If you'd like to leave any comments or if you've got any questions, anything you thought we did well, anything you thought we didn't, we've got a few different things coming up over the next few months with many different dental professionals that work for Primo Dental. Until next time, see you soon.